The Profore MultiLayer compression dressing is an effective intervention that will result in significant reduction in lower limb girth. Profore is a dressing with high resting and working pressures due to the long and short stretch materials. The kit itself consists of a wound contact layer, which is meant to be placed over an open wound if present, so that the fibers from layer 1 do not come in contact with the wound tissue. Layer 1 is natural cotton bandage. Number 2 is the light stretch, short stretch conformable bandage. Layer 3 is long stretch compression bandage, much like an ACE wrap you're familiar with. And layer 4 is a cohesive bandage. Before applying any type of compression device, it's essential that a basic vascular exam be performed to assess the patency of the arterial perfusion of the lower limb. Per the manufacturer, a person's ABI must be at least 0.7 to consider use of a Profore dressing. It's also recommended that a thorough skin assessment be performed prior to applying the Profore, and if a wound is present, wound care treatment should be completed. Appropriate skin care should also be performed, as skin will dry out from the presence of dry materials in contact with the skin 24 hours per day. The person's positioned with the knee and ankle at 90 degrees. It's important for them also, if they're able, to actively dorsiflex the ankle throughout the application so the anterior tibialis and hallux extensor tendons are prominent during the application. Apply layer 1 from the base of the toes to the knee using a simple spiral technique and 50% overlap. There's no need to apply tension to this layer. You may choose to apply any extra cotton material to bony prominences, such as the tibial crest or the malleoli, as needed. If there's a draining wound, this layer acts to absorb the exudate as well. Here I am demonstrating the relative elasticity of layers 2 and layer 3. Apply layer 2 again from the base of the toes to the knee, atop layer 1, using a simple spiral circumferential technique. Apply at 50% stretch and 50% overlap. For maximum patient comfort, leave a slight border of layer number 1 exposed at the proximal end to prevent subsequent bandages from rubbing on the skin. If there's extra bandaging material, be sure to cut it off at the proximal end so that there's not more bandaging proximally than distally, because that'll provide additional compression proximally, which we do not want. Layer number 3, the long stretch bandage, is applied from the base of the toes again to the knee, this time using a figure of 8 technique at 50% stretch. Use the central colored line as guidance for your 50% overlap. Notice that all the layers are on an acute angle. No layers are at a horizontal angle. Again, using tape to secure the dressing. Layer number 4 is applied from the base of the toes to the knee, going back to a spiral circumferential technique with 50% stretch and 50% overlap. Press lightly on the bandage to ensure that the bandage adheres to itself. After application, it's recommended that both the comfort of the person and their capillary refill of the toes be assessed to ensure that the patient's circulation is tolerating the dressing. A properly applied Profore dressing develops up to 40 millimeters of pressure at the ankle and around 17 millimeters of compression at the calf. The dressing should feel snug and comfortable. The frequency of dressing changes will vary with each patient from as often as a few times per week to weekly, depending upon the amount of wound exudate, girth reduction, and comfort of the patient. Once girth reduction plateaus, patients may be transitioned to long-term edema management products, which I will address in other videos. In this photo, the right leg was obviously treated with compression dressings. The left leg was not. Thank you for your attention. I look forward to speaking with you again in the future.